My real name is Lori Golden. Everybody calls me Smokey. And I was diagnosed with stage 3 breast cancer in the fall of 2006. My husband said, well, I'll come with you. And I go, no, I want to shop afterwards. This is nothing. I'll be out of there in 10, 15 minutes.
I'm Frederick William Wallace. I was diagnosed with prostate cancer. I would say in terms of the way I mentally approached life that I believed myself to be very healthy and still do, but in spite of this. But bottom line is I was pretty confident that I was a healthy man.
My name is Margaret Major. I discovered I had a lump, and when I went to my doctor, she sent me here for a biopsy. So I came in, but I honestly didn't think that I had cancer. I was quite sure I didn't. I wasn't worried at all.
Angela Miles, breast cancer, and it was November 2010. The waiting is the worst. You're very anxious. You can't sleep. It's all you can think about. Do I, don't I? So the waiting is tough.
When I was diagnosed, I kept it to myself. And so somewhere in there, rightly or wrongly, I consciously made the decision that I was going to do this on my own.
I did not tell, other than my husband, I did not tell anyone. I can say that after the diagnosis was confirmed, probably one of the hardest things I've ever done is tell my children.
So I'm a radiologist at this hospital, a diagnostic radiologist. A significant amount of our work is interventional radiology, which is the part I like the best. 50% of the patients we see in this end of the department are patients with cancer, and we see them for all kinds of reasons. But we now offer a whole gamut of procedures that support the care and management of oncology patients. And so that program will continue to expand once we have new equipment here.
I am Dr. Abu. I am the medical oncologist and hematologist here, and I am the current chief of oncology. Patients are getting different lines of treatment. They're living much longer now. Even in a non-curative setting, we are obviously curing more patients, definitely, but unfortunately in situations where we are not able to offer cure, we are definitely able to offer them hope, to live much longer and much improved quality of life,
That's one of the first things they told me here is that you will receive the best treatment, that you will get, this is the standard of care, and you will get it here for this disease.
I think the chemo room at the beginning may have been the scariest aspect of the whole procedure. Scarier than surgery, I would say.
There was lots of support, family and friends. It's amazing, actually. There was a ton of support, and yeah, it was just gradually, it got harder and harder on it. It seemed, she started to lose her hair, and then pretty soon she got shaved because she said, well, I was going to follow it and I'm going to take it out, so that's what she did.
You get to know the staff. You get to know some of the other patients. I basically chatted my way through cancer, I think, because everywhere I went, there'd be somebody else that kind of wanted to talk, and it made time pass. And there's nothing that makes you feel more comfortable than seeing a familiar face.
Coming to Owen Sound for treatment made a really big difference. I know I drive half an hour, but that's nothing. I had to go to London for radiation, and then I had to live away from home. I had to leave my family, I had to leave my children. And that was very hard. I did see them on weekends, but their parting from me was very painful. And I could come here for my chemotherapy, and like I said, I had to come a lot, 5 months, and then I had to come weekly at the end, which was a lot. And if I'd had to travel really far, I would have had to stay away from home all that time. I would have had to, for sure. So it made a big difference to come here.
Well, I feel great today, and it's come out fairly public in the last year or so, in the last 6 months, that this is what I've been dealing with for a year and a half, and most people are surprised. And I'm thinking, well, you haven't seen me be weak, you haven't seen me be sick, you haven't seen me struggle, and I think that's the reality of prostate cancer.
After the cancer diagnosis, I have more of appreciation for family and friends, less appreciation for work and stress. It is still part of your life. I think it's taught me to try and get that balance that we all talk about.
You speak up about things you might not have in the past. You don't wait to do things because you may not have a whole lot of time to do them in. That's true for everybody, really, but it just becomes clear when statistics start being put in front of you about who survives and who doesn't.
You can't underestimate, good care, good hands, and in Owen Sound and in the counties, I think my story represents that you're getting the best care possible. Like I say, there's not a great deal of difference between me then and who I am now, other than I've had a pretty significant operation. And having said that, I've had all of that done right here. And so if we can expand and if we can upgrade our facilities and make them even better than what they are right now, then that's a major bonus.
I hope for a cure for cancer.
And I'm grateful. I'm grateful for every machine and piece of equipment and pill and person, and grateful for my family. I think I just have I'm just grateful to be here to watch my grandson be like he is.
I desperately wanted someone to say to me, "You're going to be fine," but nobody can. Nobody can say that. So you can't say to somebody like that, "It's going to be okay," because we don't really know. But we can say, "You can get through the treatment. You can do it. You have the strength inside of you. So you're afraid, but you can do it."